Hello and welcome to Health Professional Radio. I'm your host, Neal Howard. Thank you so much for joining us today. It's been said that obesity is one of the greatest challenges to our healthcare system as it stands today, a major risk factor for the development of more than, 100 complications, including diabetes, hypertension, heart disease, sleep apnea, and so many others. Our guest in studio today is Dr. Glenn Rich. He's an endocrinologist who's recently been certified as a diplomat by the American Board of Obesity Medicine, a designation that represents the highest level of achievement in the medical specialty of obesity medicine. Dr. Rich has also established the Weight Control Center at Fairfield County Medical Group, and he's here today in studio with us to discuss some genetic and environmental components to obesity. Welcome to Health Professional Radio, Dr. Rich.
Thank you, Neal.
Now, you've been recently certified as a diplomat by the American Board of Obesity Medicine. Talk about the Weight Control Center at Fairfield County Medical Group and how it identifies genetic and environmental components associated with obesity.
The Weight Control Center is a sort of multidisciplinary approach to patients using both physicians, nurse practitioners, nutritionists, hopefully some exercise, and possibly psychiatry people to help with the patients. A lot of the genetic stuff that you can figure out from the family history of patients. It's very common when you speak with a patient who is overweight or obese. When you ask them about the family history, they will tell you that every member in the family has been heavy their whole life. And often these patients will tell you history that they were overweight as young children, and it has persisted throughout their life, and it's only gotten worse. So you could, by history itself, you can figure out a lot of the genetics that the familial history that you have in these patients. And when there are studies done, when you take twins who are born together and were separated at birth and raised in different environments, about 65% of their weight correlates to their genetics. Yeah. So it's a very powerful part of why some people are overweight and some people are not.
Most of our listeners are healthcare professionals themselves, but just for my own clarification, discuss the differences between being overweight, obese, and morbidly obese.
The differences are sort of characterized by the BMI, and it's in some of the guidelines by the Endocrine Society and the American Association of Clinical Endocrinologists and the Obesity Society. And normal weight is considered a BMI between 18 to 25. Considering overweight is considered between 25 and 30. And then they actually got to use sort of classes of obesity, class 1, class 2, class 3. And class 4 and above class 3 is considered what used to be called morbid obesity, but now it's a much better way of using class 3 or class 4, which is a BMI over 40 or a BMI over 50 for class 4. There's also classifications of whether they have any complications from the weight issues in terms of do they have diabetes, do they have other metabolic abnormalities, do they have sleep apnea. So you have a lot of other factors that you sort of use to sort of assess your patients. So usually the BMI is the main thing, and then you look at what complications the patients have secondary to their weight, and that's how you sort of use your approach to addressing the patients.
Does being overweight automatically equal being unhealthy?
There are some metabolically relatively healthy patients who are overweight. Whether that is going to persist like that or whether that's just earlier in the disease and at some point they will develop some other complications as a weight-related disorder, we don't know yet. But there are some people that are relatively, do blood work, when you look for complications, at least at the time that you meet the patient, they are what's called relatively metabolically healthy. But the vast majority of the patients will have some metabolic abnormality.
Is it more difficult to reverse obesity in a person that is more likely to be affected genetically or by lifestyle?
The genetic part is very challenging because you can't change the genetics. So if they're genetically prone to be overweight, you have a lot more hurdles to overcome to really work with lifestyle and stuff. But most patients, even when they gain weight through lifestyle stuff, there may be changes that go on in the brain in terms of the hypothalamus, and this theory that the dietary stuff with high fat, high simple sugars may damage a portion of the brain called the hypothalamus that can help regulate hunger and help regulate metabolism. So once that's damaged, either by genetics or through dietary changes, it's very hard to reverse.
At the center, do you ever address, when you're talking about genetics being, family history and whatnot, do you ever address genetically modified foods as a contributing factor to obesity? I mean, processed foods, obviously, but when we're going for the, the fresh things, the stuff at the farmer's market, trying to, become healthier and, improve our eating habits, some of the foods are genetically modified. Is that something that you've discovered as being a contributing factor?
I'm not sure we have any evidence that that type of food really is a major contributor factor. We do know that a lot of the stuff added into processed food is not good for weight. Probably a lot of the sweeteners, a lot of the processed corn syrup, and all the other foods that are processed are not very healthy. Whether some of the other stuff placed on foods for growing in terms of pesticides, whether that has any role, we don't really know right now. But I don't think there's any data that I know about the genetically modified food and whether that has a role in terms of weight management.
When is a candidate the right candidate for surgery?
There needs to be a couple of factors that are present for someone to be a candidate for surgery. To be a candidate, first of all, you need to be of a significant body mass index. And the body mass index is sort of the cutoff is a body mass index of 40 or a body mass index of 35 if you have significant comorbidities such as diabetes, sleep apnea, other comorbidities that go along with that, then the cutoff will come down to 35. There's some thought that that should be even lower because some of these weight management surgeries, bariatric surgeries, can often have a major role in reversing diabetes, or at least treating diabetes, and they actually have many studies that show they actually have improvement in life expectancy in patients who undergo these surgeries. So right now the cutoff is 40 for no complications, or 35 with significant clinical complications from the weight.
Now, where can our listeners get more information about the Weight Control Center at Fairfield County Medical Group?
Right now, we are under process of redoing our website, and hopefully that should be up and running with some of the information about obesity, and that is at www.fairfieldcountymedical.com, and we're located in Trumbull, Connecticut.
Thank you so much. You've been listening to Health Professional Radio. I'm your host, Neal Howard. It's been a pleasure talking with Dr. Glenn Rich this afternoon in studio. Certified as a diplomat by the American Board of Obesity Medicine, he's been in studio with us talking about genetic and environmental components that are associated with obesity, and also talking about some of the factors that come into play when surgery is being considered. It's been great having you here with us today, Doctor.
Thank you so much.
Thank you. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to our podcast on iTunes.